The sour relationship between resident doctors and the federal government has degenerated over alleged threats of no pay, no work, mass sack. The striking doctors are adamant. As president of the Association of Resident Doctors, Uyilawa Okishe Henyi, said the threats by the Minister of Labour and Employment, Chris Ngige, would not compel them to call off the nationwide strike. Ngige has also vowed not to meet with them again on how to resolve the logjam. This is not healthy, Judy. If the minister that is meant to lead the mediation and see the way forward, if the minister is saying that he's not going to meet them again, now, not taking into conclusion that across the country, we have casualties every day. We don't have statistics to prove how many people will die or are on death row, and as a result of this striking resident doctors. So this kind of nonchalant attitude, or saying you're not going to meet them again, this seems very arrogant to me.
Very callous.
It's very arrogant, and ordinarily the minister should resign if he does not think that that job, if he cannot give his best, if he cannot come down from his Olympian heights and do the job for which he gets paid, then he should resign. It's as simple as that. Elsewhere, that these people could even go back on strike after having signed a memorandum of agreement of action, with the government on April 10. You cajole them to suspend their strike, and then you refuse to implement the demands that were agreed. I've had the federal authorities put all the blame on the states, but that is being dishonest. Some of the issues that we are talking about have to do with the federal authorities. For example, if one of the big issues for which they are on strike is the issue of hazard allowance, are they saying that, oh, this hazard allowance saying that they have not paid, is the states alone that are to blame? You got into an agreement with them that you will pay 33% of the basic salary of doctors. But up till now, you've not implemented it. Since April 10, you've not implemented it. That's taking them lightly. That's treating them shabbily. And now they've gone on strike. Is it because public officers, their children don't go to public hospitals? Is that why we are saying this? Because if every one of us is mandated to use public hospitals, yes, including our president and everyone, will a minister have the cheek to say, oh, I don't even want to talk to them anymore? How do you even wash yourself clean of what we are going through at this time? Did you do your own bit? The answer is no. Honor your word. It's as simple as that. If you honor your word, or even come to the middle, I'm sure these guys are not unreasonable. They are gentlemen. They will call off the strike. But talking, using fighting words at a time when you are supposed to be conciliatory, I don't think is dignifying, and I don't think it exhausts the minister. Who does the minister think he wants to impress by saying that I will not talk to them? I've told my children that they should not join the strike, and my children are doctors. I've told them they should not join the strike. Who is impressed by all of that? Get the doctors to go back to work. When you get them to go back to work, people will be convinced that you've done your work. That's what Nigerians are after.
If you are talking about other sector that is not as essential and critical as medical doctors, seeing the brain drain we are witnessing in that industry, you will not even have that the audacity to come up with no work, no pay policy.
But you must understand that the same minister we are talking about once told us that we have excess requirements, that we have too many doctors, and that some of them should go and do tele.
And that turned out to be a lie, a big fat lie.
Because you are a doctor doesn't mean that you know where the shoe pinches. You've been in politics for 20 years. I don't think you've been a full-time practitioner for the last,
when was the last time
25 years. So the problem they face now is not the same problem you face in your day.
Yes.
And that's the problem we are facing as a people. The minister has put himself in the place of the federal government and think that it is the states. That's the way he talks. He talks as if it's the states, and that without him nothing will get done. Because you and I know that the residency is a critical aspect of medicine, because they are between the students and then a specialists, and they form the bulk of doctors in our country. The more you isolate them, the more problems we have. I think the problem really is the minister, not the doctors.
Jide, okay, let's join Mahmoud Ataga.
Jega.
Yes, Mahmoud Jega. What do you make of the minister's statement, Mahmoud?
Yes.
The minister is threatening not to meet with the striking resident doctors again.
Well, that was a terrible thing for the minister to say. You cannot take that position as long as the matter is not solved and the doctors do not call off the strike. People are dying, there is a lot of inconvenience, so he has to continue to engage with the doctors no matter how inconvenient it is. But the truth is that Dr. Ngige has never proved to be the best negotiator in these situations, because he often takes a very combative position, not only with the doctors but with the other unions that were on strike over the years. And it is not the healthiest. It is, of course, frustrating that doctors and sometimes lecturers, judiciary workers, everybody goes on strike almost every year. It is not the best. We have to find the best ways of resolving these problems before they resort to strike. With respect to the other issue you raised about non-payment of salary during strikes, let's remember that that one has been low for quite some time in Nigeria. And really, I think it is important for labor unions to realize that no matter how serious your grievances are, anytime you instruct your members to stop working, then you have to make arrangements to pay them. You cannot withdraw your services and still demand to be paid. In other countries, labor has a strike fund, which it accumulates over the years, and whenever it calls a strike, then it pays its members for the period of the strike. But it's not really right to go on strike indefinitely, sometimes like in the case of ASU 9 months, and still demand as part of the resolution to be paid for that period when you are not working. No. That is not the law, and it's also not questionable.
Yeah, but actually, when you look at Dr. Chris Ngige is a medical doctor, the Minister of State for Health is a medical doctor, the Minister of Health, these are medical doctors. A lot of people feel that they should be sympathetic with this association, and they should understand what is actually going on. That, look, priority should be given to this sector, and they should make a case that if an agreement has been signed since April.
Yes, that's the problem. I want to believe that some of those problems even these ministers cannot solve. We've got to brush aside bureaucracy in solving some very critical problems bedeviling our nation. For example, even when you get into an agreement to pay, how about cash backing? How about the long period that it takes for money to be released? We are in a country where budget performance is anchored on the release of funds. Funds are sometimes not released until the third quarter. So how can some projects be implemented fully when funds don't get released in good time. So if we can solve that problem as well, if we can reduce the time within which decisions can be reached and money gets paid, then some of these problems will no longer be there, because I know that even when you take the decision, then the issue of funds will come in. For example, some of the demands that the lecturers are making, funding is critical. So a minister could actually do his best, hammer out a deal with striking workers. The finance ministry still has to do its job of ensuring that, okay, money gets released to ensure that the agreement reached is implemented. So largely, bureaucracy gets in the way of even effective running of the system. So we have to deal with that. The issue
when negotiating, that all these stakeholders should be part of the negotiation. Ministry of Finance, people that will be there to give a cash backing.
yes, that's a good suggestion, but it still wouldn't
Changing it.
Change the process.
Yes, the process, the devil is in the process. So we've seen even finance ministers promise that, okay, we'll release so amount of money, and it doesn't get released on time, because it's not something that gets done by maybe
Fiat.
by fiat. So this is the thing. The system itself needs to work better. The wheel of progress needs to run better for us to be able to achieve some of our aims. And the governors of some states that are owing doctors, medical doctors of all people, in excess of 6, 7, 8 months salary,
Why?
they need to be spoken to, because it's part of where a governor fails to pay workers regularly. Remember, they have opened state universities that they cannot adequately fund, and some of these state universities also have teaching hospitals. So those doctors work in those hospitals, and they too are subjected to the pains that get inflicted on workers in those states. So those governors, those states also need to be spoken to. It's difficult, even if the federal government team hammers out a deal with these doctors. The issue of doctors in some states being owed several months salary will also be, I'm sure they deliberately included it in the negotiations as a way of helping their colleagues, because they were saying, look, these are our colleagues, we can't, we really need to come to their aid. So they need to talk to some of these governors, because the demands that are being made are genuine, and they must find the funds to pay.
GKB, let's look at the effect. You know, we are very poor with keeping records, statistics, data. But I can tell you the number of people that would have lost in the last 72 hours in the country.
Not only that, remember the number of people that cannot be admitted. Remember, we are talking about those already admitted who have to let go. That you have to go home, there's no doctor to take care of you. That will probably be in their thousands. Imagine the number of people who fell sick in the last 72 hours who cannot go to the hospital. There's something on I think it's on TVC, of a man somewhere in Yola who took his father to the hospital. And the doctor told him to his face that he cannot treat the man because they are on strike. And the man died on the floor. The man, I think it's on TVC, or one of the TV stations. Imagine that level of callousness that you require, because you took the Hippocratic oath, basically, to protect lives. That's why you become a doctor. That's the first duty you do. Government have their own issues, of course, but you cannot see somebody dying and then apply civil service mentality in applying your job to that person. That to me is the danger, because our people will now revert back to traditional healers to take self-medication. And that is even more dangerous going down the line, because already, you know, cholera is back, and the disease is back.
COVID is here.
So many things are back. People are dying in the Federal Capital Territory in their hundreds for diseases that have been wiped out technically 10 years ago. I mean, this is a planned city that cannot even take care of waterborne diseases. Imagine the doctors now being on strike.
Mamu Jaga, Mahmoud Jaga, we seem not to value human lives in Nigeria, both on the part of government and even on the part of the striking resident doctors.
Well, certainly we can say that because, almost every hour, what is even the quality of our health care when the doctors are not on strike? There is still a shortage of medical personnel, shortage of facilities, lack of access to drugs and dressings. People don't have the money to pay for even basic services. So those problems were there all along. And you can imagine when the doctors walk out, that is why it is difficult for doctors to have public sympathy when they go on strike, no matter how genuine their case appears to be, because for somebody who brings, like you said, his father to the hospital, and you say you are on strike because of hazard allowance or even non-payment of salary, that does not make sense to somebody who is about to lose his father or some other loved one. Now, what is not to say that the government itself at all levels should not be alive to its responsibilities and toy with a very serious sector like health care. Maybe unlike education, education takes many decades to see the result. If the schools are closed for 1 year, we may not see the effect until maybe 15, 20 years from now. But in the case of hospitals, if they're closed for even a day, the consequences are immediate. People die, people are sick, so you are absolutely correct that we do not seem to value human life and human health in our situation.
These doctors are also saying that they are among the poorest paid doctors, least paid doctors in the world. That's the allowances, and anytime you keep talking about that 5,000 naira hazard allowance, I can't just wrap my head around it. That's what's 5,000 naira?
Yes, and it's been there since 1991. They've made efforts to have it increased. During Jonathan's era, they wanted to move it to 7,000 naira. They didn't succeed.
5,000 to 7,000.
Since 1991. So you look at what inflation has.
Yes.
In fact, inflation in the last 3 years has been really tremendous. The numbers are scary. So now we are talking about what you could do with 5,000 even last year. You can't do it this year because COVID did its worst, and insecurity is also a critical factor in the uptick in inflationary figures in our country. So it makes sense to increase the hazard allowance because somebody risks his life to save lives.
Even increasing
that person is very, very important. The one who puts his life on the line to save lives. Yes. Now they've lost 19 of their colleagues, to COVID, while in the line of duty. Those colleagues they are complaining that even the entitlement of those colleagues, government is yet to pay. So there are reasons why workers go on strike. We don't want a nation where workers go on strike many times or frequently, but our government needs to do a lot more. Our government needs to do a lot more to ensure that these strikes do not happen. And we hope that the minister will go back to negotiate with these doctors. Otherwise, the president should mandate someone else to do it. We can't leave. He's issued this kind of threats in the past, and it amounted to nothing.
And you beat some person to go back to the negotiation?
Yeah, he's issued this kind of threats in the past, and because these workers, they know the strength, they know their strength, they know that, look, you cannot hire people to replace them. This is not practicable. So you just have to find a way to resolve this. Come to the middle ground, resolve it, and stop backing out directives as if they
We are in
They
the
work.
military
They
regime.
work under your roof.
All right.